Picture this. You've just risen for the day, fumbled with your phone alarm, and suddenly the morning hunger pang strikes. Your mind pivots to breakfast options. Will it be Weet-Bix? Some porridge? Toast, perhaps? No, it won't, because you have a condition called dysphagia, so you will be having a prescribed breakfast fed via a tube. Kia ora koutou katoa. I'm Shnece Duncan and I'm an economics PhD candidate at UC. Now, some people with dysphagia experience a mild discomfort swallowing, but other patients develop the condition at its worst and are unable to safely swallow any food or liquid. If these patients did try to eat some Weet-Bix, they're likely to inhale the food, causing an infection in their lungs that could kill them. Currently in New Zealand, I have estimated that 75,000 individuals are living with the effects of dysphagia, and despite this significant effect, there is very little data on the economic impact of the disorder. So my research uses economic tools to estimate the cost of dysphagia in New Zealand. Understanding the magnitude of the negative impact of dysphagia in New Zealand will enable me to provide evidence for funding to treat dysphagia and evaluate different treatment options. There are lots of different costs to think about when estimating the economic impact of a condition. Probably the most obvious would be the additional medical costs caused by the condition, but I also need to include the foregone income of the dysphagic patient who couldn't make it into work, and the foregone income of the dysphagic patient's caregiver that must now stay home to look after them. Even the dysphagic patient's reduced quality of life needs to be quantified in order to really capture the magnitude of this issue. Overall, this work can help assess the needs of the future dysphagic population so adequate healthcare is funded and provided. The work can also help with assessing the cost effectiveness of new medical interventions for dysphagic patients to ensure funding is provided for the best possible treatments. With adequate healthcare funding to support services for dysphagic patients, you could start your day with some Weet-Bix again. Thank you.